Welcome, everyone. Thank you so much for being here for this first of our 2024 Community Education Series. We're delighted to have you. Again, as you come in, if you can mute your mics. And I just wanted to share a little bit for anybody who's not familiar. I think most of you are, but this is presented by the Peaceful Presence Project. We are a 501c3 nonprofit community-based organization in Bend, Oregon. And we have a mission to reimagine and transform the way that communities talk about, plan for, and experience serious illness and the end of life. We envision a community across our cultural society where every community member receives equitable and compassionate care through the end of life. I am delighted to introduce you all to our speaker this evening, Tamara Ostervoss. She has almost 15 years of experience in the death care industry, and she serves as director of OHSU's Body Donation Program. Tamara is nationally recognized as a leader in the ethical management and utilization of whole body donors, and is a board member on the West Coast Body Donation Consortium. Her professional interests are in policy development and advocating for the inclusion of underrepresented groups in anatomical resources. Welcome, Tamara. We're delighted you're here, and I'll hand it over to you to start your presentation.
All right. Thank you so much for having me. I read about some of the amazing work that Erin had been doing with Peaceful Presence, and I reached out to her several months ago to learn more about the program and how it could potentially support people who contact our program that may be planning for their own death or their loved one's death. So thank you for the work that you do. I know it's not easy. I know it can be really hard work, and sometimes it may not always be recognized, but I certainly appreciate it. I know when I speak with families, they appreciate the support that they receive as well when they're going through this process. All right, can everyone see my screen? All right, perfect. If you have questions while I'm going through the presentation, feel free to mute yourself and just jump right in. Otherwise, you can certainly wait until the end. There will be time for questions as well. So what we're going to talk about tonight, defining what is whole body donation. So we all have kind of a shared understanding of what we're talking about when we use that term. We'll talk a little bit about whole body donation in general, and then we'll also talk a little bit specifically about OHSU's body donation program and some of the services that they provide to donors and donor family members. We'll talk about the donation process, and then again, we'll have a time for questions. So first things first, what is whole body donation? And the definition in and of itself is pretty simple. It's the act of donating one's body after death to science. And that can mean a lot of things, right? That term science. It may mean that an individual could support anatomy education. And when you think of anatomy education, that could be kind of like a first-year medical student that may be dissecting a donor to have a better understanding of the foundations of anatomy that they're going to use for the rest of their healthcare career. They could also support surgical simulation, and that also is kind of exactly like what it sounds. It's a simulated surgical environment. So this could be a resident, it could be a healthcare provider that's practicing surgical skills in a very lifelike environment before they're actually practiced or used on a living individual. And then lastly, a donor could support research, and research can be varied, right? It could be educational research, it could be, biomedical research, or it could be research on a specific health condition. Not all programs support all of these things. They may support a combination of them or one or two of them. So it's really important if someone is interested in whole body donation, they understand what they're supporting and whether or not it's in alignment with what they want to support. One thing that's important to note is that whole body donation is different than organ donation. A lot of people believe that when they went to the DMV and they checked that box and they got their license back and it says anatomical donor, that they're also registered to be a whole body donor. And that's not true. It does require specific consent forms to be completed to the program that they wish to donate to. So why do people choose to donate? Donation is a really personal choice. It's not for everybody. And, it's really important for people to be informed as to, what program they're donating to and what they're supporting. But over the many years that I've been doing this, the central theme that I hear from individuals when I speak with them is that their true motive as to why they want to donate is simply to help others. And what help looks like to them can vary kind of based upon their experience, but it kind of fits into these general themes. A lot of individuals who choose to be donors to our program, they worked in healthcare. They benefited from the gift of a whole body donor. Some of them worked, with donors in their anatomy education in their youth, and they want to give back in that same capacity in the same way that they were able to benefit from. Some individuals have anomalies. There may be some variation in their anatomy or, some variation in their body that they want individuals to see. So people that have similar anomalies can kind of benefit in the healthcare treatment that they receive. And that also kind of ties into the impact of disease pathology. Sometimes people may have had a health condition, a chronic health condition for a long time. It greatly impacted them, and they don't want other individuals to kind of have that same fate. And so they donate in the hope of kind of providing that knowledge, potentially research as well, so people can benefit in the future. So what are some things that people should know about donation? As I mentioned, it's a personal choice. It's not for everyone. And if people are considering donation for themselves or for their loved one, these are things that they should ask the program. This is also information that should be on their consent form to really truly give informed consent when it comes to the donation process. So these are the things that I always recommend people ask about the donation program. So one is to understand what type of donation program it is. There's kind of two different types. One is academic, that's usually associated with an institution. So in Oregon, there's two academic body donation programs. One is OHSU's body donation program, and the other one is Western Health Science University's body donation program in Lebanon, Oregon. And specifically when it comes to OHSU's body donation program, we have kind of specific requirements that we must follow as an employee of their organization, right? We have an employee code of conduct. In addition to that, we have an advisory board specifically for our program, and we also have a board of directors that we have to report to. So even though I am the director of the program, I don't get to make the decisions myself. There's individuals that I have to present information to. They make informed decisions as to how our program operates, and I adhere to those standards. In addition to that, as an academic institution, we also have an IRB, which is an institutional review board. So any research requests that we receive into our program, it has to be approved by them and reviewed to ensure that there is scientific merit in the request that is being asked. Non-academic programs are not affiliated with an institution. They are a private business or company that may be operated by individuals. They may or may not have a board of director. Their oversight can look completely different than what I have just described. So it is important to know what type of program it is, whether it's academic or non-academic, and then what their oversight and structure kind of looks like for their decision making. In addition, it's important to know what the program requirements are. So unfortunately, not everyone who wants to be a donor is able to be a donor. There are specific program requirements that individuals must meet in order to be eligible. They do vary from program to program. They usually have to do with communicable disease risk. And then the other requirements kind of have to do in relation to what the program supports. And that's why they kind of vary from program to program. And I will go into more details as to what our program requirements specifically look like later on in the slideshow. Another thing that's important to know about donation is support. I mentioned kind of these areas before, but does the program support anatomy education? Does it support surgical simulation? Does it support research? Does it support all those things or a combination? And if a family is, interested specifically in a certain type of research, can the program guarantee that their loved one will be able to support that type of research? Another important question to ask is when it comes to location. Where is the body donation program located? In addition, where do the donors go? Do they support education in the state of Oregon and the Pacific Northwest, throughout the United States, internationally? These are all important questions that people should know to be able to make an informed decision for themselves. And then lastly, a very important question for people to ask has to do with final disposition. What are my final disposition options? Is it cremation? With cremation, are you able to receive the cremated remains back? Is it a partial return of the cremated remains? Is it all of the cremated remains? If someone doesn't or is in alignment with, the cultural belief of cremation, do they offer earth burial? Do they offer the ability for there to be alkaline hydrolysis or, resumation, as it's called? And even as Oregon has transitioned to other different types of final dispositions, such as composting, is that something that they're able to accommodate? Those sort of things are really important for people to understand to be able to make an informed decision for themselves. All of this information should be able to be obtained by speaking with an individual. They should be incredibly transparent about how their program operates. And again, all of this should be in their consent form to really truly give informed consent to the person that is making the decision to donate. A little bit about OHSU's body donation program. Our program is to serve the healthcare needs of all Oregonians by supporting medical education of students, faculty, and practicing healthcare professionals and researchers. As you can see here, this is the state of Oregon, and each one of these little dots represents some sort of affiliation with OHSU. So this may be a clinic, this may be residents that are serving rotations in these locations, etc. As you can see, almost every county in the state of Oregon does have some sort of affiliation with OHSU. Even though the donors may be on our Portland campus, we do have residents that come and clinicians that come to our Portland campus that receive training and benefit from the gift of whole body donors, and then bring that education and knowledge back into their community. So really, truly, if you receive healthcare in the state of Oregon, you have benefited from the gift of a whole body donor, whether or not you may be aware of it. Our staff is pretty small. Our program has 3 full-time staff members, myself included. The other 2 are Adam and Chris. Adam is on the end and Chris is in the middle in the blue shirt. We are 3 licensed funeral directors, embalmers, and crematory operators in the state of Oregon. And we oversee all aspects of the donation process. So if you call our program during business hours, you will be speaking with one of us. We do outreach like I'm doing here with you. We also speak with healthcare providers at the time of death. We are the ones who are preparing the donors when they support education. All of our donors on the Portland campus are kind of within our space. So we really truly do have oversight of them the entire time that they're in our care. Donors will support education at OHSU anywhere from 1 to 3 years. And we serve about 2,500 learners throughout that time frame each year. So when you think about the gift of whole body donation, it really truly is pretty impactful on the education in the state of Oregon. When a donor is no longer supporting education, we move forward with final disposition. We do have a crematory on site, and our staff do perform the cremation ourselves. We also have the ability to not perform the cremation on site. So if families want to witness the cremation, if they want to work with a specific facility within their own community, we can return that donor back to that chosen facility and they can move forward with cremation or final disposition there. We also can return the donor for a full casketed earth burial. We also have been working with families to accommodate other options as well, such as alkaline hydrolysis. There have been people that have reached out to us about the composting option as well. All these sort of things we can accommodate. We do truly want to make as many accommodations as possible when it comes to what they would like to do with themselves or their loved one for final disposition. But we need to know these things kind of before they come to our program. So we always recommend people pre-register, and I'll talk about that in a little bit. We also provide a memorial service. So each year I work with the students of the various programs that are whole body donor support to have a unique memorial service for the loved ones of the donors. So some eligibility requirements. So these are the requirements that an individual must meet in order to be eligible to be a donor. We do require all individuals to be over the age of 18 in order to be a donor to our program. We do not have an upper age limit, so we can have people live very, very long lives and still be a donor to our program. We do require individuals to be free of communicable diseases. These would be such diseases such as hepatitis B or C, HIV/AIDS. That also would include active infections at the time of death. Anyone who has a healed surgical procedure would be eligible to donate. I know that's a common question that we get from individuals. Oh, I've had, XYZ procedures. Am I still eligible to donate? Absolutely. The only time that we would decline someone for surgical procedures is if it was very extensive and it was not healed. That kind of ties into individuals must be free of trauma at the time of death. So if you think of, students that may be learning anatomy, they need to have kind of an anatomical system that hasn't sustained trauma so they can have a better understanding of kind of what the foundations of anatomy are that they're studying. We do require individuals to have a postmortem interval of less than 48 hours. Sometimes we're able to extend that time frame just depending upon the situation. So the reason why we have that postmortem interval, which means we need to receive the decedent into our care in less than 48 hours from their passing, has to do with the serology testing. So we draw blood on all of the donors that come into our care, and we send that off for testing for hepatitis B and C. And the lab that does that testing cannot validate results unless that blood has been drawn within 48 hours of death. So in some instances where the family may want to do a private viewing or a private service or whatever it may be, sometimes we work with funeral homes where we go to the site and we may draw the blood, or we'll work with medical examiner or other teams to make sure that that can happen so we can accommodate any kind of final wishes that they may have. And then lastly, we do require individuals to be within kind of an average weight and height ratio. So we don't, people who may be on the low end or on the very high end may not be eligible to be donors. And I know that can be something that's really, really frustrating. And I certainly can understand and appreciate that. However, we have to have that in place in order for us to store an individual in a dignified manner. We do have a rack and tray system that does require individuals to be under the height of 6'4" in order for us to store them in a dignified manner. And then additionally, the embalming process that's used for anatomy education does create additional weight on an individual, anywhere from 80 to 100 pounds. And so as you can imagine, depending upon what the weight of someone may be, an additional 80 to 100 pounds could make them not able to be stored within kind of that rack system that we have. So if someone is interested in donating, one thing that I always recommend is that, one, they contact the program that they're interested in, ask those questions that I had kind of outlined to you about, where is the program located, what type of program it is, those sort of questions. If they determine that that program is in alignment with what they want to support and what their beliefs are, then I recommend that they complete a consent form. Our consent forms can be found on our website. We can also send physical copies to people upon request as well. There is no expiration date on these consent forms, and they can always be revoked. So if someone changes their mind 20 years from now, they can call our program, they can let us know, and we will return their consent form back to them. So we do always recommend that people complete one if they're interested, but they can always change their mind and revoke it too. We do recommend that if people complete the consent forms, that they do provide them back to us just so we can verify that everything is completed correctly. It does require a couple different signatures, and sometimes people may hold on to the consent form. They wait until the time of death to provide it to us, and we review it and it's not correct. And that can be really, really stressful. because then they need to find signatures, go through that whole process again. So if they do complete it, have them submit it so we can review it to make sure it's correct. You may be wondering what the typical procedure is at the time of death. One, we have to be notified that the death occurred. Sometimes people do not notify us, or a hospital says to the family that they will notify us on their behalf. And sometimes they may not notify us on their behalf in a timely manner. So we do always recommend that people give us a call to let us know, and then we'll kind of start the process from there. So when we are notified, we'll go through a risk assessment, and that requires some questions about medical history. So if a family member were to call us, we can do this conversation with them if they have a good kind of information about their loved one's medical history. If they don't, we'll just ask them questions about who their healthcare provider is, and then we'll reach out to that facility and go through that screening with a healthcare provider there. We also do ask questions about kind of the physical assessment of the donor. Part of that has to do with the ability to determine if we are able to store them in a dignified manner as part of the embalming process, and just kind of the height and weight ratio. That conversation, if someone is familiar with the donor's medical history, or if they have access to their medical records, typically takes anywhere from 10 to 20 minutes. Once that information is verified and we determine that the donor does meet the eligibility requirements, we do transfer them from the place of death to OHSU. I do have a note that there may be a variable transportation fee depending on the county that the death may have occurred in. One thing I will say is that in the state of Oregon, OHSU does cover 100% of the transportation fees. So there is no cost associated with donation in the state of Oregon. Outside of that, there potentially could be some costs if they were in Idaho or Washington, and the family could just call us and we could provide them an estimate on what that may be. So the donation process. So once we receive them into our care, we do that serology testing that I had mentioned. So we draw the blood, we send that in for testing. We also request medical records just to make sure that nothing was missed in that phone call that we had. We collect biographical information from the next of kin for filing of the death certificate. So we do file the death certificate on behalf of the family. The family does have to order the death certificate themselves, and they are responsible for the fees of what the death certificate copies cost through the state or county of death. After we receive negative serology and the medical records are reviewed, then the donor is matched with the course assignment, and they can support education anywhere from 1 to 3 years. A really common question that I get is, how do you know what the donor is going to support? And I actually don't know. The donor's medical history is what determines what they're going to support. So kind of the way that they live their life and the disease pathologies that they had determines kind of where they're going to go. Sometimes there are course directors or researchers that are looking for very specific things. Sometimes that's how a donor is kind of matched as to where they go. And sometimes the family wants to support very specific things. Though we can't guarantee that a donor may support what the family wants them to support, we try to kind of match it if it works in that sort of situation. After that time frame, final disposition does occur. And as I mentioned, it kind of depends on what the individual has chosen on their consent form as to what their final disposition looks like. And lastly, I want to talk a little bit about our donor memorial service. This is something that I look forward to every year because it's an opportunity where we get to meet the donor family members. We always have it the first Friday in December. We have a hybrid option where it is in person, but people can join from across the world and participate in the memorial service as well. I work with the students of the medical school, dental, physician assistant, and radiation therapy programs to kind of host and design this memorial service. And like I said, every year it's different. The students really truly design it to share appreciation and gratitude and thanks in their own way. So sometimes that may be a musical performance, that may be a dance. This young woman here, she was, I think from the Hawaiian Islands, and she did kind of like a hulu sort of dance for the audience to show appreciation and gratitude. We also have faculty members that come and speak about how important whole body donors are, not only to their education while they were, in medical school, but also how they apply that knowledge to the patients that they treat today. We do try to kind of honor our donors in multiple different ways. So for our donors who happen to be veterans, we do provide honors for them as well through the Oregon Honor Guard. And then one thing that we do as well is we open the floor up to the donor family members. So we provide them a time where they can speak directly to the students as to what the donation process meant to them, what the experience at the memorial service means to them and their grief process. I think it's important to acknowledge that a lot of individuals who choose to go through the donation process don't necessarily always have a memorial service or kind of a public acknowledgement of the loss that they've had. And so this can be incredibly important for them to participate in, especially to be in a room with individuals who know what it's like to not necessarily have closure of their loved one's death for a year or 2 or potentially 3 years. And so it's always really incredible to hear their stories and kind of camaraderie that they have with one another. We also provide an opportunity for them to have a slideshow remembrance of their loved one as well. So if they want to send a photo to our program, we'll include it during the memorial service so we can recognize and honor their loved one. So in review, body donation is important for medical education research. If you ever attend one of our memorial services, you'll hear that from the faculty members. You'll hear that from the students directly. There's lots of different options for anatomy. There's virtual anatomy, there's, textbooks, models, but being able to work with the donor and really see what you are trying to learn. And then in addition, have the humanitarian aspect of it, of, practicing your professionalism, seeing this individual as your first patient, is something that a textbook or a virtual reality program just can't replicate. And then lastly, donation is a personal choice. It's not for everyone, and people do need to understand kind of what they are signing up for or what they're signing their loved one up for. And not all programs are the same. They really need to ask those questions that I've kind of outlined earlier in the slideshow to really have a better understanding of if this is something that is in alignment with what they want to support. All right. Does anyone have any questions that you would like to talk about?
I have a question that came up for me.
Yeah.
I was just thinking about once you receive a donor into your care and go through the process, how long is it before they are serving the students or the research typically?
Yeah, it kind of depends. So if someone kind of goes through the process and we say that they're going to support, let's say, anatomy education, they're going to go through that embalming process. And that embalming process takes about 6 months before they're able to be in an anatomy course teaching the students. And the anatomy courses at OHSU are anywhere from several months to over a year long. And so that's kind of why that time frame comes into play of anywhere from a year to 3 years. For an individual that may support surgical simulation, for example, they may immediately go to support surgical simulation once we have the kind of clearance with the serology and medical records. And sometimes with research, it can also be years long, just depending upon kind of what the research is that they're supporting.
Thank you. And then did you see the chat? How many donors do you receive yearly?
Yeah, absolutely. Great question, Peg. So on average, we receive anywhere from 100 to 125 donors a year. And that's not a limit that we have by any means. We receive a lot more requests from course directors than the number of donors that we receive. So it's really on average about 100 to 125 people are eligible to be donors. In most instances, about 75% of people who would like to be a donor are able to be a donor. So about 25% are declined every year.
So I have a question, and this
Yeah.
goes to the physical height and weight, because I actually have somebody that's interested in doing this. And so when you say 80 to 100 pounds and 6'4", 80 to 100 pounds is pretty limited. I'm thinking about the person that I have in mind. Is that once all the fluids are gone? I mean, that's pretty light.
Yeah, so when I say 80 to 100 pounds, I mean that's how much additional weight the embalming process adds. And so we factor that into when we're kind of giving the weight range. So on average, if someone is between kind of 15 BMI or 27 BMI, they're eligible to be a donor if they're under the height of 6.
Okay.
Yep.
Okay, that helps a lot. That
Yeah,
helps a lot,
sorry
'cause
if
I was
that
gonna
wasn't
say that-
necessarily
Yeah.
clear. Yeah.
Okay, thank you.
Yeah, so Colleen had a question about, can a donor request not to be embalmed? Yes. So that is something that they can write in on their consent form. So for example, if someone wanted to go through that composting option, or if they wanted a green burial, they cannot be embalmed in order to move forward with that final disposition option. So if someone does select that as a final disposition option, we absolutely accommodate not doing an embalming to support their final disposition requests. If someone submits their consent form, but their family doesn't want to follow through with the donation process, what happens? Yes, this does happen sometimes. So legally, we could accept the donation. As a policy, we do not accept the donation. We, are very strong believers that the individuals that they leave behind are the individuals that are going to have to live with this decision, right? And 1 to 3 years is a very long time to wait and to have those sort of feelings and tensions and everything while you're going through that grieving process. So if family is not on board, we do not move forward with the donation, because that's not something that we want to, we don't want to do to them, frankly.
And can you speak to the opposite of that? If maybe I think you had said, can a decision be made for the donor by the family?
Yes, so a decision can be made for an individual who's not able to make decisions for themselves anymore. There is kind of like a hierarchy of who can make that decision based upon Oregon Statute 97. If there is written express of the individual that they do not want to donate, sometimes you'll find it in kind of like their healthcare authorization or their post or whatever it may be. They state that they don't want to be a donor. If the family were to try to submit consent paperwork on them, we would also decline the donation in those sort of situations. But if the individual just maybe didn't have the opportunity to make the decision for themselves before they kind of declined, the family could, if it was in alignment with what that individual wanted to do in life.
I'm a volunteer with the Trauma Intervention Program of Portland, Vancouver, and we are almost always on the scene right after, in the immediate aftermath of a death. And what I've noticed, and if you can speak into, if you have any insight, is there are some people who they're like, sorry, why can't we just do body donation? And they don't want to deal with anything with the funeral, or this person, they might have said this person wanted to do this, but none of the paperwork was done ahead of time. So do you have any advice as to how to best handle or, reply to something like that?
Yeah, absolutely. So if they didn't have the paperwork completed prior to the death, that is something that the family could complete after death. We do run into situations sometimes where, let's say someone had a power of attorney, it wasn't a power of attorney that extended into death. And so then sometimes there can be a conflict between who has kind of legal authority to make that decision versus who thinks they have the authority to make that decision. So that's why I stress so importantly, if someone is interested in whole body donation, to complete the consent paperwork themselves and have that conversation with their family. But at the time of death, yes, the next of kin could complete that consent paperwork. It's important that they are able to understand everything that comes with it. Sometimes when people are making that decision at the time of death, they're going through a lot of things, right? They may not understand what it means to wait 1 to 3 years, how that may impact them. So when people call our program and it may be a situation where the death was unexpected or they didn't have a lot of time to process it, we always try to really stress that with them, because that can be something that can be difficult 2 weeks, 3 weeks, a month down the line, when you're starting to process that information and realizing what you may have signed up for.
Well, I absolutely welcome more questions if they pop up, but I just kind of wanted to comment my appreciation for the way that you all have designed your program and this obvious level of compassion that you all provide for the families and for the donors. I was really struck just watching seeing the pictures of the memorial service and what dignity and, again, compassion that provides. And I just think it's such an honoring that it's not just, it's not a small thing that somebody chooses this. And so you've really done a beautiful job of honoring that. And as many of the folks who are on here are end-of-life doulas, I just was struck like, wow, this is like the body donation doulas, right? Like you just have this really beautiful, heartfelt way of treating these individuals and these families. So I want to voice my appreciation for that.
Thank you. I really appreciate that. That does mean a lot, because I know, as many of you have seen in the media, sometimes that's not the case with body donation programs, right? That's why I stress so hard kind of those areas of what individuals should look for, what questions that they should ask, because you're right, it isn't a small decision that people make. They're literally gifting themselves for the benefit of strangers, of society. And it really is, I mean, I see my role as a guardian of the gift. It's my job to protect them and to protect the gift of whole body donation, because everyone ends up benefiting from it, whether or not they know that they do.
Thank you. And I do see one other question in the chat. Can the funeral home be bypassed entirely and transportation be done from the place of death?
Absolutely. So we do have a transportation team that we dispatch directly from Portland if the donor meets the eligibility criteria. That being said, we also are more than happy to work with any funeral home that the family wants to work with. I know sometimes families do have kind of ties with different funeral homes in the area, especially in rural communities. And if they want to have that local funeral home do the initial transfer, file the death certificate on their behalf, we also will reimburse the local funeral homes for the work that they do as well, because we want to support families as much as we can in the decisions that feel is right for them at the time of death. So yeah, we try to be as accommodating as possible. So we do have a team, but we also will work with local funeral homes too.
So I have a piggyback question off of that, which would
Yeah.
be, we do a lot of work advocating and educating people about their rights for home funerals as well, and their own rights for taking care of their deceased. And so I guess I would wonder if a family could deliver their loved one to your program.
So yes and no. So we have the transportation team that's located kind of outside of the OHSU campus. And the family, if they do want to transfer up to Portland, they can do that transfer to that facility. And then that transfer team would transfer them to our OHSU campus. As long as we know in advance, we can help coordinate that with the family, no problem. Yeah, we also think that's really important as well for them to be able to participate and provide that level of care for their loved one too. I got one more question. Is there a way to track the status of the donation? So yes and no. So some families, they don't want to know anything about what their loved one supported. They just want to support them and that's what they want to do. And they don't want to hear anything else about it. And we respect and honor that. For some families, they want to know everything that their loved one did and the learners that benefited from them. And in those instances, all the family has to do is call us and we will provide all that information to them. They just have to make the request.
Well, this is clearly an interesting topic with such good questions. I really appreciate that that you do this, that you get out and educate as well, right? And giving empowering families and empowering community members with the knowledge of this program and the knowledge of what makes a quality program, the questions that people should be asking. I really appreciate that as well. And so I just give one more minute if anybody has another question. Otherwise, I'll let us all get back to whatever I imagine wintry weather we're all in this evening. I see Mary Elizabeth. Yeah.
Yeah, I just have another one out of curiosity. So there's academic and there's non-academic, right? And the non-academic are usually for-profit companies. And I'm just curious, would that be like for internal research? I just have this really awful thought, like these for-profit companies aren't selling bodies to medical schools, are they?
I can't necessarily speak on behalf of what they support, because I don't work for them, so I don't necessarily know. But they, depending upon how they operate, they may support, medical education. They may support research. It might be a different level of research than what is happening at an institution that I don't necessarily know. So it's always important to ask those questions
Okay,
directly
okay,
to that
yeah,
program
because
as to
I
what
was
they
just thinking
support.
like when we're advising, but yeah, I was just kind of curious about, makes you think. It just makes me really think hard, but thank you.
Yeah, absolutely. Peg, did you have a question?
Just, yeah, I was in the same wavelength as Mary Elizabeth, just wondering if there are any non-medical donation programs in Oregon.
There are several non-academic body donation programs in Oregon. Some of them have gone through AATB accreditation. Some of them work with the OHA and have their accreditation. I really believe in informed consent and people kind of supporting what they believe in. What's right for me might not be right for them, but as long as there's transparency and they're able to feel empowered in the decision that they're making, that's kind of what matters.
All right. Well, thank you so much, Tamara. I think everybody, I can see all these claps and head nods and hearts for a really wonderful presentation. We absolutely appreciate you. So thank you so much.